The other thing that you need to take into consideration massively with decannulation is access. So can that patient open their mouth? Can they either actively open their mouth? Can they stick out their tongue to command? Or are they so hypersensitive and they've got so much reflex activity going on around their mouth and their temporal muscles that we can't actually access the mouth? So if we do wean and remove the trachea, we've got no means of access to their chest, which is a situation that is very unique to neuro patients. I mean, ENT patients, they have tracheas put in, but that's because of they're going to have swelling, which is going to prevent the management of their own airway. So once that surgical swelling has gone down, they are able to have that tracheostomy out. And there aren't generally many secondary complications, but a trachea in a neuro patient is a very unique, the issues surrounding it are very unique. And I think that's very difficult for families to understand and accept. But yeah, the access bit is a big thing, and that's again where we work very closely with the nurses and the speech and language therapists, because the speech and language therapists do the hypersensitization work, the desensitization work with the nurses, and the nurses carry the main burden of that, or they're the people that are the main perpetrators because they need to do it all the time.
And how does that work? What would they do?
The desensitization process is a process that allows you and allows the patient to become acclimatized to being touched around the face and mouth area without a huge reflex action of clamping down, biting of lips and grinding of teeth. So it starts at the hands. It's a slow process. You place your hands on their hands and slowly move up bilaterally to their hands and up through their hands, elbows, shoulders, neck, and then you come onto their cheek, applying gentle but firmer pressure as you go onto their cheeks, then onto their top lip, and then onto their bottom lip, with the aim that once you get to there, that touch and that stimulus around their mouth won't be an alarming stimulus for them. It will be a natural progression of the precursor of the desensitization. And that works with varying degrees with different patients and on different days with the same patient. Hour to hour, it can be very different. So it's a continual assessment. But that the ability to be desensitized has a huge effect on their trachea outcome.